so much for taking time to watch the Health Channel. Today we are going to discuss on newborn menses and breast lumps. This can really be shocking, especially for the first timers. And for that reason, you need to continue watching this clip. All newborns are usually exposed to lots of hormones while they are still in the womb. Now for some, they'll come out with evidence to that. For newborn girls, usually their genitalia look swollen or a bit prominent than normal, quote unquote, and they'll also have some whitish discharge from the vagina. That is very normal, and usually with time, everything will shrink and the discharge will also disappear as the hormones fade. Also, for some girls, on the second or third day, you may also experience them passing some blood from their vagina. We call that newborn menses. It's just evidence that the hormones that were exposed to are actually now officially fading away from their system. As a parent, you should not panic or worry unless the bleeding is profuse. We say the bleeding is profuse if whatever is coming from the vagina is actually more or equal to the amount that the baby would pass as urine at a time. So if you see anything like that, please remember to go to hospital. But if it's just very slight, some reddish discharge you find on the diaper, you just need to relax, and within 3, 4, 5 days, that will also disappear. And the next time we'll have to deal with menses is when they're going to start their real menses from a decade or so from the time they're born. The second thing is breast lumps. It is very normal for newborn boys and girls to be born with breast lump, or them having breast lumps on the first or second day of life. Again, this is just evidence that these babies have been exposed to the mother's hormones. Usually it's very tempting for you to try to pinch them as a way of making them shrink, but please try as much as you can not to do that, because that will just irritate even more the lump and sometimes even make this lump get inflamed and maybe infection, who knows. So the best thing to do is, if you have a baby having a breast lump, what you need to do is just leave it as it is. With time, at first it may increase in size, but with time the shrinking will just happen as the hormones continue to fade off from the system. And in case that this baby has infection on the breast lump, what you need to look out for is signs of inflammation, which means they are either red, depending with your skin color, they are warm to touch, they are usually very tender, and when you squeeze them, it's not just milk that comes out, but you also have milk mixed with pus. So in case you think that at one point in time when you're trying to squeeze this, the baby it was not painful, and then now whenever you just touch the baby's breast or chest, it's becoming painful, please remember to go to hospital, because this can be infectious and can also be very bad, especially it being a newborn baby. I really hope this is helpful. Thank you so much for taking time to watch this, and keep it at the Health Channel.